Hi, I am Andrea Wongsam, a proud volunteer for and supporter of the American Heart Association. As a heart attack survivor myself, I am so excited to sit with you to talk about the critical importance of women's cardiovascular health. The Red Chair Series Conversations seeks to inspire and inform women to be strong advocates for their health and well-being. Let's dive in. Dr. Hanghang Wang is a cardiothoracic surgeon with Johns Hopkins Medicine. Welcome, Dr. Wang.
Thank you so much, Andrea.
Please tell us a bit about yourself and your practice.
I am a cardiothoracic surgeon at the Johns Hopkins Hospital, and I'm also an assistant professor of surgery at Johns Hopkins Medicine. I practice both at the Baltimore campus and Suburban campus in Bethesda. I practice a wide range of procedures in cardiac surgery, including coronary artery bypass surgery, valve surgery, and aortic surgery. But I have a special interest in mitral valve repair and aortic surgery.
Wow, excellent. Dr. Wang, I had a heart attack at 35.
Oh my gosh, what was the experience like for you?
It was actually quite frightening and surprising. I did not think that at 35 heart disease would be relevant to me. I know that more women die each year from heart attacks, and it's still yet thought of as a man's issue. Why is that?
Yes, that's a great question, Andrea, and it's really unfortunate. I think historically there's a lot less research in women and heart disease. Most of the research in heart disease were focused on men. And women, a lot of women do not realize that they have heart disease when they are diagnosed, and they are seen much later, and they are treated much later in the course of their disease as well. We know that 1 in 3 women suffer from heart disease annually. This is more than all kinds of cancers combined for women, but unfortunately, there is not as much awareness of heart disease in women as in men.
Dr. Wang, are there specific heart conditions that are more prevalent in women than men?
Yes, Andrea. I would like to know what your experience was like being diagnosed and treated for a heart attack.
I can say this, I had the best treatment because I was here at Johns Hopkins Medicine, but also it took me a long time to go to the urgent care, to go to the hospital and seek care. Just because I didn't actually know that I was having a heart attack. I didn't recognize the symptoms or the signs.
That's a really frightening experience, and that happens to a lot of women, in fact. When they realize they were having chest pain, they don't really think of heart attacks, and when they're treated in emergency rooms, oftentimes doctors do not think of heart attacks as very top on their differential diagnosis either, and this delays their diagnosis and treatment significantly. Also, women tend to present later in the course of their disease. A lot of the clinical guidelines we have for indications for surgery are developed using data from men. So women oftentimes present much later and are treated at much more advanced stages of their disease.
Is there anything else you would like our audience to know?
I would love to add that women really should advocate for themselves when they have any symptoms of chest pain or discomfort or even fatigue, vague symptoms. They should go to their doctor and get checked up, especially if they have a genetic disposition. For example, if they have any family members with heart disease, that increases their risk of heart disease.
Thank you. That includes our time today. Thank you so much for sharing with us on this critical topic. The American Heart Association has great resources online at www.goredforwomen.org for you to learn and share. Again, huge thank you to you and Johns Hopkins Medicine for supporting this campaign.